everyone. Welcome to the Level 2 Health and Social Care webinar. We're here this afternoon just to talk you through the course a little bit, and it will give you an opportunity to ask any questions that you'd like to ask. My name's Zoe Bailey and my colleague Deborah Bryan's with us today as well. So hopefully between us we'll be able to answer all your queries. Okay, so we're really lucky in our health and social care team because we've got a really big team of staff, all very experienced and have worked or had experience of lots of different areas of health and social care, from the NHS and nursing to youth work, etc. So we've got a wealth of experience of teachers for you to be supported as you go through your course. So at level 2 then, we offer the OCR Cambridge Technical at level 2. So this is a vocational route into health and social care, whereby we have a variety of units that you study, and for each of those units you'll be assessed in a variety of ways. So rather than studying a course for the whole year and doing an exam at the end like a GCSE, this course is built up in units, and we offer an extended certificate and a diploma. In order to get onto a level 2 programme, you'll need to meet the college standard entry requirements, which is 5 grade Ds or 3s at GCSE or equivalent, and you must have your English language. And obviously if you want to study health and social care, an interest in that environment is obviously going to be beneficial to you. So a Cambridge Technical is a slightly different qualification. Some of you might have studied Cambridge Technicals at school, but essentially they're qualifications that provide introductions for people looking to build careers in health and social care. So things like careers in the NHS, social care, community support and outreach, occupational health, etc. might be some of the areas that this sort of qualification might lead you into. So Cambridge Technicals provide a very real world approach. So everything we do in the classroom, all the studies that we do, is always linked to work and the job role and the environment and all those skills that we can use as we build a career in this sector. So the two courses are different in size. So they both operate over a 1-year programme. The Level 2 extended certificate is equivalent to 2 GCSEs, and the diploma is equivalent to 4, which obviously means that the diploma is the bigger course. So that takes up around 10 lessons a week, and the extended certificate takes up about 6 lessons a week. So rather than being graded in numbers like your GCSEs, this is graded in pass, merit and distinction, which is equivalent to GCSE grades. So just to give you a little bit more information there then, here we've got a list of the units that you would study in the extended certificate. And if you were doing the diploma, you'd study those same units plus 3 others. Assessment is over the entire course, so for each unit you'll be assessed, and that's via a coursework portfolio. So many of the things that you'll be assessed in might be things like presentations, written reports, posters, leaflets. You might do some role play or some practical where we might take videos, etc. So it's not an exam-based subject. So in the classroom, we try as much as we can to vary all the different things that we do. So obviously there will be some sitting down and learning, but where we can get you up and about and doing practical things, we will. We'll try and involve the employment sector as much as we can, either in the class teaching or maybe having visitors in. You'll be expected to be able to do some research. And again, like we said before, presenting your work in a variety of different ways. So the written reports, presentations, interviews, etc. Lots of people think when you come to college that you don't get a lot of student support. Obviously that's not the case. Teachers are really willing to help you to be the best that you can be. Everyone can access support for their learning. So it might be that you might want help with your subject material that you're covering. It might be that you want to clarify something. It might be that you've been really good and done some extra work and you want your teacher to have a little look at it. In addition to teachers' help, we also operate a student mentoring programme, and we also have lots of access to online learning resources. So if you work really hard at level 2 and you manage to achieve your distinction, then that indicates to us that you are able to progress onto level 3. So that would be the equivalent to A-level programs or level 3 Cambridge technical programs. Obviously, you could continue on to health and social care at level 3, or you could consider other subject options. So that just gives us a rough overview of the qualification. What we want to do is to look at some questions now. So we've got a question here that says, what is the average sort of class size? So I'm going to pass that over to Deb. If she, don't forget to unmute.
Hi.
Hi, Deb.
Hello. The average class size, we try and keep them fairly small, but I think the average class size would be around 12 to 15 students, and it can be smaller. So that's about average.
Okay, thank you. So somebody else has just asked, they wanted to clarify the number of lessons that they might have in a week.
Okay, so you'll have 6 lessons for certificate and 10 lessons for the diploma, which is the bigger course with 8 units.
And I suppose most people, because if you're doing a level 2 program, you're going to be doing other GCSE programs alongside that. So most people doing a level 2 program would be doing the equivalent of 5 GCSEs. So I suppose they could do diploma alongside their maths, maybe, for example, or you could do 2 certificates alongside the maths, because obviously, remember, we're looking for the English.
Yeah. So lots of people do that, getting either maths or English additionally to their OCR technical.
Okay. So somebody's asked here, what sort of careers might we go into if we choose health and social care?
Well, there's so many careers. The NHS itself is the biggest employer in Europe, and there are so many different jobs behind the scenes other than the ones that you see on, your television, like, or on the news. So more than nurses, you could be a phlebotomist, you could be an occupational therapist, you could be a play therapist, you could be a care worker for somebody with learning difficulties who lives on their own and wants support. So there are actually hundreds and hundreds of different jobs, plus the social care sector is now a massively growing sector and looking for suitably qualified recruits.
Okay, thank you. I've got a question in here that says, would this course help to get into the midwifery sector?
It would, providing you get a distinction overall from your level 2 courses and you can get on to level 3. Midwifery is very, very competitive, so you would have to work really hard, but some of our students have successfully got onto midwifery courses, and I've visited people on work experience who are working on midwifery wards. So yes, we do have people who succeed in that occupation.
Okay, that question was from Demi, so thank you for that, Demi. The other question we've got here is, do I get the chance to do any work experience?
Yes, normally, in normal times, we definitely expect everybody to complete work experience, as it is a mandatory part of this course, because it's one thing to be a vocational subject, but it's very important to actually get some work experience. So what I also tell students is it's very good to additionally try and do some voluntary work to get the taste of what it's like in a work environment. And in normal times, we would expect students to set up their own work experience in either a health or social care setting, such as a care home. It's been more difficult this year, but we always hope to do that. Plus, some of my actual students at the moment have jobs in the healthcare sector.
Brilliant, thank you. One other question that's here, could you just tell us a little bit about the types of subject areas that we might study as part of health and social care?
Okay, if you do the diploma course, there are 8 units. So additionally, you would do individual needs, people's individual rights. A lot of the units actually tie together. So when you do equality and diversity, because obviously we as social and healthcare workers come into contact with people from every walk of life. So we do equality and diversity. So other than those sort of sociological subjects, we also look at practical subjects such as health and safety and security. And we look at the body, the human body, anatomy and physiology. And so the range of subjects is incredibly broad and all really based on what it might be like to get a job in health and social care and the sort of skills and knowledge that you will need in those fields.
Okay, a couple more coming through. Can you tell me if I have to sit any exams?
No, there are no exams at level 2. It's all a portfolio of assessed work that you submit online, and you get feedback online, and then you make changes, and then you submit the final piece of work, and the work will be graded from pass, merit to distinction, and the pieces of work build on each other as you go through the unit, so that the distinction is the hardest, and merit is the second hardest, and pass is the easiest. But they all round up together to make a full package of work that shows a full range of your skills.
Okay, I've got a question here about T levels, so I'm going to answer that one. So the question is, do we offer T levels? That's not something at the moment that the college is offering. We're only offering the Cambridge Technical route through the OCR exam board at the moment. Last question then, I think. Practical, do we get to do any practical in lessons?
In normal times, we would get to do quite a lot of practical things. So it's not just sitting writing notes or watching videos or completing worksheets. We like to practice lots of things like hand washing.
Oh, we seem to have lost Deb there. Oh, she's back.
I'm back.
You're back.
Okay,
yeah.
apologies for that.
That's all right. We got to hand washing.
Yeah, hand washing. We might do some actual first aid, hands-on first aid. We use dummies to practice heart massage and CPR. We practice by going to different settings. So once I took my students into the kitchens of the college so we could look at health and safety and food safety in an actual working kitchen environment. So we do try and get out of the classroom whenever we can. So we can sometimes do health and safety checks on a local park in case you were a childminder taking a child to the local park. We also have quite a few medical people who can come in and talk to us, so doctors, nurses, and we do try and use a lot more practical methods of learning, interviewing each other, making videos, and as much practical work as we possibly can, really.
Okay, I've got a final question that's just come in here. It says, is there any exams that I would have to sit at level 3?
At level 3 health and social care, yes. If you do the diploma and the higher level courses at level 3, there are some exams in January. So for example, with the diploma, you would have to do 3 exams in the first year and 3 exams in the second year, as well as a portfolio of assessed work that is assessed internally by your teachers. So the exams are marked externally, but for level 2, no, it's just for level 3, there are exams.
Okay, thanks, Deb.
Okay.
Okay, I think that brings us to the end of the questions. So I hope that this has been useful for everybody. If you have any further questions that you'd like to ask, you can email at enquiries@wqe.ac.uk, and we look forward to hearing from you.
We do.